Getting cleaned out is important, but who's doing your colonoscopy and where it's done is also important. Make sure that you're seeing someone who's very experienced. Gastroenterologists are your experts. We're the ones who perform this procedure every day. So, if you're going to do some of these screening tests, what can you expect? For the stool-based tests, it's putting a little bit of stool on an applicator device and sending it in. That's called a fecal immunochemical test. So nothing sexy about it, but that's the way that goes. You send it back to the physician and then it'll be processed there. If it's negative, make sure you do it annually. If it's positive, that's going to prompt a colonoscopy. So if you have a colonoscopy, let's go over that a little bit. So what can you expect on the day of your colonoscopy? Well, after the preparation the day before, you'll come into the endoscopy center or the hospital. And at that time, the nurse will go over a series of questions with you and they'll put an IV in you. You're generally sedated for this test, and there's two types of sedation. There's Demerol and Versed, perhaps, but more often and more commonly, we're using propofol. You'll go to sleep real quick and you'll wake up real quick, and you'll be relatively alert after the procedure. Now, the gastroenterologist or the specialist performing your procedure, the procedure itself takes perhaps 15, 20 minutes to do. And at that time, they'll look and identify and remove any polyps that may be there. So if you have a colonoscopy and we find polyps, what's that mean? Well, if you have one or two small polyps that we call adenomatous, we're going to generally recommend that you come back in 5 years. If we find 3 or more, or if it's a larger polyp, or some of the characteristics underneath the microscope are a little bit more aggressive, then we may recommend you come back in 3 years. If there's no polyps and we get a great look, meaning your preparation is real good and we're able to visualize the entire colon, we may not need to do anything for 10 years. If you have polyps removed, you should be notified by your physician's office about the results. There's two major types of polyps. There's adenomatous polyps and hyperplastic polyps. It's the adenomatous polyps that we generally worry a little bit more about turning into cancer. We don't think that for the most part, hyperplastic polyps ever develop into anything serious. In terms of family history and genetics, there are a couple of things that only a small number of people are affected by. One's called FAP, familial adenomatous polyposis. If you have that, you are almost guaranteed to develop colon cancer. It's unusual, but it's out there. The other is called HNPCC, hereditary non-polyposis colorectal cancer. It also affects a small number of the population, but you need to be screened very frequently if you have that condition. Let me explain the difference between screening and surveillance and diagnostic. Screening means that we're doing a test on someone who has absolutely no symptoms. That's the screening colonoscopy or the screening test. Surveillance means that we are re-examining someone who's already had polyps. So if we take out a couple of polyps 5 years before, the colonoscopy that you're coming back for is called a surveillance colonoscopy. If you had no polyps and you're coming back 10 years later, that's called a screening colonoscopy. A diagnostic colonoscopy is done when someone has symptoms, change in their bowel movements, blood in their stool, unexplained abdominal pain, or weight loss. Now, we give these all three different terms, but you know what? The procedure is exactly the same. The gastroenterologist performs the same procedure. You're sedated the same way. It's just that these terms are a little bit different and sometimes can be confusing.